There's so much that we share that it's time we're aware it's a small world after all. Words from the famous Disney It's a Small World. Working in the healthcare world introduces us to social determinants that make us realize how small the world is. Every decision and action that we make greatly affects the result of health management of our patients. Good evening, my name is Kaitlyn Locke, and I am the Chief Diversity and Inclusion Officer of this organization. Today, we will talk about the importance of patient advocacy and culturally responsible healthcare. Social determinants of health and culture also impacts a person's health. World Health Organization in 2003 defined social determinants of health as socioeconomic circumstances that affects health throughout life. It may be categorized as social gradient, stress, early life, social exclusion, poverty, work, unemployment, social support, addiction, food, and transport. These categories may affect people from participating in education or training and gaining access to health services. Negative impacts of social determinants of health can be socially and psychologically damaging, materially costly, and harmful to health, according to the World Health Organization. As an administrator in the healthcare field, the challenges of creating a team of professionals that render high quality of care in this modern day and age is evident. According to the Agency for Healthcare Research and Quality in 2014, it is important for administrators and healthcare providers like us to provide cultural competency training to providers. It is important for healthcare providers to understand how cultural determinants affect the decision making process of the patients. Cultural sensitivity and unbiased quality of care is key in reducing disparities in cultural competence, according to the Agency for Healthcare Research and Quality and Betancourt Green, Carrillo, and Park. The goal of cultural competence is to create a healthcare system and workforce that are capable of delivering the highest quality of care to every patient, regardless of race, ethnicity, culture, or language proficiency. They stressed out that caring and respecting the diversity of the patient population is a great cultural factor that affects healthcare outcomes. According to the United States Department of Health and Human Services, the national standards for culturally and linguistically appropriate services in health and healthcare is a movement that is aimed towards the improvement of the quality of services provided to all individuals, which will ultimately help reduce health disparities and achieve health equity. It is actually utilized to tailor services to an individual's culture and language preference. Health professionals can bring about positive health outcomes for diverse population through the same language medium. It resolves any miscommunication through loss in translation situations if we specifically use these services that addresses specific languages the patient requires. In addition to education and training, changing clinical environments can also be key to purposeful change in behavior. Oftentimes, healthcare providers are confused on how to handle and manage cultural diverse situations. Cultural competence entails respect, understanding, trust, and acceptance. According to Rene Bowman Schmurr in 2015, healthcare providers should act as patient advocates by understanding the patient's cultural beliefs. It is important for healthcare providers to embrace the needs of the patient and incorporate culturally appropriate interventions in managing their healthcare needs. Specific, meaningful, useful interventions will allow patients to feel more empowered and valued as part of the healthcare team. The culturally sensitive health empowerment of patients leads to better engagement and compliance with care of culturally diverse adult patients, according to Tucker et al. In 2014. It is a great factor to provide the foundation of trust in a nurse patient relationship that encourages patients to express their healthcare concerns, beliefs, and goals during the beginning of patient healthcare encounter. It is essential to acknowledge that sometimes, as an administrator or a healthcare provider, it may require acceptance of the difference between the patient's cultural beliefs from the provider's beliefs. It may be challenging, but it is important to keep in mind that providers and advocates and must retain patients' trust, respect, and understanding the patient and their cultural beliefs. As a healthcare administrator and provider, knowing what we believe in and what core competencies we have causes an impact with the quality of care we provide. In a study by Matthew and Piketchatu in 2017, they explained how reflective practice is a cyclical process that can be used to look back on what was done and use it as a teaching moment. It is important for healthcare providers like us to look back on situations that challenges our cultural competence. It allows us to handle similar situations in the future. Interprofessional education and training, like what we are doing now, comes into place after evaluating the responses and how it was made before. It is very important to ensure that the goal of patient advocacy and safety is the priority, and no personal or cultural belief of the providers can hinder the provision of adequate care that the patient needs. Here are the references if you need to look back on them. Thank you for listening and have a good night.